Jenifer Rajkumar, thank you so much for being with us on ITV Gold. How are you doing today?
I'm doing great. Thank you so much.
Of course, we have to have you because you are a South Asian American Assemblywoman for District 38 in the New York State Assembly, and we have lots of questions for you. But just starting this interview, I'd like for you to respond to the Capitol attack that we saw a few weeks ago. How did that make you feel as a legislator, as somebody who's a part of the Assembly, and as a South Asian American woman? What kind of impact does that kind of an incident have on you?
The peaceful transition of power is fundamental to democracy, and America has always been known for its peaceful transition of power. So this was indeed shocking, and I think our whole nation at this point is forward-looking with the inauguration of the new president. President Biden, in his inauguration speech, made it very clear that his goal is to unify this entire country. And in fact, he likened himself to Abraham Lincoln, who presided over the American Civil War, one of the most divided times in our nation. And it really struck me that in Biden's inauguration speech, he likened himself to Abraham Lincoln. And he said, "My whole soul is in this. And I will be here to unite all Americans, to unite the whole nation." And he said, "I ask all Americans to join me in this cause." So right now, we are all looking forward to the unification of the United States of America so that we can get things done and finally end this global pandemic.
How are you looking at these domestic terrorists, Jenifer? They've been called that. It was an insurrection. Everyone's saying that. How did you look at those people?
I embrace all Americans. I think that everyone should make their voices heard. However, what happened at the Capitol was unacceptable. And most Americans feel that way as well. There wasn't anyone that I know who was watching that who thought that this was acceptable. It was shocking. And in fact, 10 Republicans joined the Democrats in the impeachment of President Trump for the second time. Right. So across the nation, we are united in condemning the Capitol attacks. It was indeed shocking. I will say that I embrace all voices in this country and believe that we need to make a place for everyone at the table. But domestic terrorism is unacceptable.
Right. And Jenifer, currently there are threats coming in from all across the nation on potential attacks again. What are you hearing in the State Assembly about it, and how are you all making sure that you're all safe and sound?
Safety is a top priority. And in fact, many of us were worried that the state capitals across the country would face similar attacks. However, on Inauguration Day, there was only one protester at the New York State Capitol in Albany. So I'm proud to say that it was, in fact, a peaceful transition of power. And I'm confident in the American people that we will uphold the democracy that we have always known. And with the inauguration of the new president and the new administration, I'm confident that America is back and that we are indeed ready to be great again.
How do you hope to work with this new administration, especially, Vice President Kamala Harris being half South Asian American? What are your expectations?
My expectations are very high because this new administration has appointed top talent to all of its key posts. Janet Yellen was just confirmed as the new Treasury Secretary. And we have several talented Indian Americans who have also joined the administration, such as Vanita Gupta and others. Vivek Murthy is the Attorney General. So I have very high expectations, especially because President Biden has spent half a century in American politics and in government. So if there's anything that he knows how to do, it is how to govern and how to unify the country. So I have very high expectations. But first, we have to get through the crisis that we're now in, which is this global pandemic.
I just have to ask you, how has your experience been so far being a state assemblywoman? How have everyone reacted to you?
It's been incredible. It's been the honor of a lifetime. I'm about to start my 4th week in the State Assembly, and it has been such an honor. I was introduced formally on the Assembly floor. We also painted the office red. So I took over my predecessor's Assembly office. and we painted it red, which symbolizes the energy that we are going to bring to the district. I'm so excited to be in the state assembly. Already, we've been able to do so much. I have co-sponsored several pieces of legislation that aim to take us out of the COVID pandemic and out of the economic crisis that we are in.
Let's discuss more about the COVID-19 pandemic and also your agenda with it. Let's start by looking at District 38's ramifications from the healthcare crisis. I know the last time we spoke, you said a lot of the members were directly impacted by COVID-19. Hospitals did run out of capacity. What is happening in the district right now? And are you worried with these new variants coming in that it's going to impact the district yet again?
Yes, in fact, my district is now the epicenter of the pandemic. The rates in Richmond Hill and Ozone Park are the highest in the entire city. So it is of grave concern. My office has made sure to distribute PPE to underserved areas, including Punjabi-speaking and Bengali-speaking areas. It's our goal to make sure that all communities are represented in the fight against the pandemic. And I have also just introduced my first piece of legislation. I was proud to co-author a piece of legislation that will help end the pandemic. And I'd be happy to speak with you about that as well.
Right. Right before that, Jenifer, what is the condition of hospitals in your district right now? I know they ran out of capacity last year when the pandemic was really bad in New York City. Where are they at right now? What are you seeing?
Hospitals are crashing. The healthcare system is completely overburdened right now. So it is a very dire situation. And what I am trying to do as a legislator and government leader is make sure that people have the full information. It's crucial that people know where to go to get a vaccination, when to go to get a vaccination. People need to be updated, and they need it to be exactly clear. It's going to take approximately 6 to 8 months to get through this pandemic and to make sure everyone is fully vaccinated in New York. And during the 6 to 8 months, I will make sure that everyone is fully informed and that the logistics of the operation are good. How to get from here to there? How do we get everyone in this community to the vaccination site? How do we get them to understand when it's their turn? So it's my goal to streamline that process and make it clear for all New Yorkers.
Jenifer, what is currently needed for the state from the federal government? What kind of help or resources does the state need?
We need incredible financial help. New York State is in debt. We have a $15 billion budget deficit right now. So we really need the federal government to come in and help us. And I'm very confident that that's exactly what the Biden administration is doing. The Biden administration has also promised to support local governments and local elected officials to aid in our efforts to help our communities. He has also invested a lot of money in a national vaccination program, which is crucial. Also, he has expanded unemployment benefits and also promised to vamp up the delivery of vaccines to New York, which is crucial because currently New York State is out of vaccines.
What is the status of vaccine in District 38 right now?
We are out of vaccines. I recently visited Queens's first major state vaccination site at the Aqueduct Racetrack in South Ozone Park. It is a beautiful site. I think everyone who goes there will feel comfortable going in. The military has come in to ensure that it's safe for everybody. It's truly inspiring, this vaccination site. The only problem is that there's no vaccines. So it is crucial that our supply is replenished by the federal government. That is what we are waiting for.
Who is to be blamed for this crisis in vaccine distribution, Jenifer? Like when you're looking at it as an Assemblywoman, what happened? Why don't we have enough vaccines being distributed?
In a sense, nobody is to blame. This is a pandemic. This was unforeseen. This is a crisis situation. On the other hand, I would have wanted the previous presidential administration to have done a better job. They had dismantled the organization that was responsible for global pandemic response. Recently, news reports have shown that the department responsible for responding to global pandemics was just dismantled. However, I'm now forward-looking, and I believe that the federal government and our state government is forward-looking. And it is our job to manage the logistics to make sure that everyone gets vaccinated as soon as possible.
Do you know when most of New York will get vaccinated? Is there an expected date?
In his latest coronavirus press briefing, the governor has estimated 6 to 8 months.
Oh, wow.
Now, hopefully, drug companies, if they're able to manufacture the vaccination in greater amounts, maybe it could happen sooner. This is really a day-by-day development. Right. Looking at the response to the pandemic. It's day by day. Every week we're getting new information, and every week it's changing.
Let's talk about therapeutics now, because there is a new legislation that you're bringing up that has to deal with the monoclonal antibody that we keep on hearing has been very effective to prevent cases in the hospital and has been given to many individuals that are also in critical care. What is this legislation that you're coming up with, Jenifer? And why are you so focused on this one therapeutic treatment?
So yes, it is true. I have in fact authored my first piece of legislation, and that focuses on the antibody treatment for COVID-19. So currently, the focus is very much on vaccinations. But what I would like to do is prevent hospitalizations in the first place. So you may be wondering what the monoclonal antibody treatment is. It became famous first when President Trump came down with the virus.
Right.
He took this antibody cocktail. And what I want to do is make sure that this antibody cocktail is available not just to people like him, but to all Americans, to all New Yorkers. I believe that all people deserve to have a treatment that could prevent them from being hospitalized when they come down with COVID-19. Currently, the federal government has over 500,000 doses of this life-saving antibody cocktail, and it has been approved for emergency use by the FDA. The only problem is that hospitals are not using it. The federal government has shipped out over 50% of its stock of this life-saving treatment to hospitals all across the country. And yet, only 20% of those treatments held by hospitals have actually been administered. So this life-saving treatment is literally sitting in hospitals unused. And the legislation I have authored aims to change that situation.
In the District 38, are you seeing a lack of the monoclonal antibody treatment in the hospitals, which are also now crashing, as you've said?
Absolutely. In fact, most residents of my district don't even know about this treatment. Most people don't even know it exists, and that's part of the problem. Healthcare providers are not informing people that this potentially life-saving treatment exists. And people are not asking for it because they assume that only famous people or well-connected people should have access to this treatment. So my legislation will change that situation by requiring hospitals to inform eligible patients of this treatment, and by requiring hospitals to administer that treatment within 6 days of a patient having a positive result, within 6 hours.
How do you plan to handle the cost that's attached to this therapeutic? It's very expensive. That's what we keep on hearing. Would you have to get that assistance from the state or the federal government?
The problem is actually not cost, because we already have the treatment. The treatment is sitting there unused. The federal government has bought over 500,000 doses of this treatment. So the problem is really in the administration of the treatment. And I would argue that, in fact, the treatment saves money, because every hospitalization costs at least $10,000. And by administering this treatment, you prevent people from death and from severe illness. So in preventing hospitalizations, it actually saves the healthcare system money.
Currently, as an Assemblywoman, what are you most concerned about when you're looking at the healthcare crisis, the system just falling? What is your biggest concern?
My biggest concern is logistics. The way to end this pandemic is to be very organized, to make sure that we have a detailed, organized plan for how everybody is going to get the needle in their arm, how they're going to get vaccinated, and how those who are eligible receive the antibody cocktail that could be life-saving. It's on helping an overburdened healthcare system streamline its procedures and giving that healthcare system the support it needs so that it can do its job. So to me, the number one challenge is simply organization and logistics. And to get on top of that, good leadership is required. Great leadership that's going to stay on top of the details and that's going to look at the data and make good decisions based on data and based on logistics and organization.
How is your agenda looking like for the next 2 months, especially with this monoclonal antibody treatment? What are you looking to do in your district for the next 2 months?
Well, I'm looking to gain widespread bipartisan support for this important piece of legislation. And I'm optimistic and confident that will happen because the state legislature cares very much about ending the pandemic. That's our number one priority. In fact, just this week, we passed a slew of legislation to help small businesses stay afloat in the pandemic and to help workers stay afloat. So my number one priority these next few months is, as I have always said, helping to end the pandemic. And coming from a district which is now the epicenter of that pandemic, it is even higher in our list of priorities. So that is why we are one of the first to visit the Queen's vaccination site, why we are authoring legislation, and my team is here 24/7 to field questions from all of our constituents in the questions of where do I go to get the vaccine? How do I get the vaccine? Can you help me make an appointment? These are questions that we're hearing every day. And I just want everyone to know that we are here for you. This is our top priority.
Right. And, people can reach out to you. They can reach out to your office if they have any questions. They can call you and, look for more resources if they're looking for. I just have 2 more questions left here for you. The first question is small businesses. It's one of my most talked about topic here. They are still in crisis. A lot of them have completely shut down. I know your district is completely impacted by that. What are you doing about the small business crisis? What do you hope to bring to this issue?
Well, I'm very honored to have been appointed by the Speaker to the Committee on Small Businesses in the State Assembly, because helping small businesses navigate the red tape and survive is one of my top priorities. So recently in the state legislature, I voted for and co-sponsored a bill to protect our small businesses. And it does that in a few ways. It creates an eviction moratorium and a foreclosure moratorium for small businesses until May 1st of this year. So that will help a lot of the small businesses stay afloat. Right. It also makes sure that small businesses don't suffer from bad unemployment insurance ratings, because that has been happening. They get an unemployment rating. And a lot of them have had to lay off a lot of workers because of the pandemic. So they won't accrue extra costs because of that. Right. Additionally, the bill also helps workers themselves. A lot of people right now don't want to take on part-time employment because they will lose their unemployment benefits. So this bill remedies that by making sure that in fact does not happen, that you can take a part-time job without being penalized for it in your unemployment benefits.
Oh, wow. What a great piece of legislation. I hope it gets approved. My last question to you has to be, it kind of deals with what President Biden has been talking about in his agenda for the first 100 days of racial justice and policing. I'd like to know where you stand in this issue and how much do you agree with the president on the new executive orders that he has made for that?
The president has done a good job from day one of dismantling a lot of the harm done in the Trump administration. So Biden has really taken on things on day one. He repealed the Muslim ban executive order that was issued by Trump, which was unconstitutional and which banned people from Muslim majority nations from entering the United States. Right away, the president made sure that the United States rejoined the Paris Climate Accord. So we have rejoined the world with regards to climate justice, and also with regards to the World Health Organization. We have rejoined the World Health Organization. So this is all very, very promising. And I certainly believe that we need to heal the divide between law enforcement and minority communities. We need to make sure that they trust each other, because that is how we're going to keep communities safer.
Well, it was a pleasure again having you on ITV Gold. I'd love for you to give one last message to all that are residing in your district, what you'd like to do for them, how they should reach out to you, how could they help you?
Number one, I would like to tell everyone in my district to hang in there. It's just 5 more months. So for 5 more months, the little actions you take make a big difference. We are in a historic global pandemic, a health crisis. So washing your hands, wearing a good mask, socially distancing, every day paying attention to those details is going to matter to save your life and to save your family's life. I also want you to know that we are here for you 24/7. You elected me by such a wide margin, precisely so that I could handle and lead in a crisis like this. So we are here for you. Call my office or contact me anytime on social media, or call the office if we can help you in any way.
Of course. Well, thank you so much for your time here on ITV Gold again. I hope to see you again very soon.
Thank you so much.